Hello everyone and welcome to part 3, the stress switch, brainwaves, chiropractic, and your nervous system. Imagine a car alarm that won't turn off. Doesn't matter that there's no threat, it just keeps screaming day and night. Your neighbors hate you and you can't sleep. Everything in the car starts wearing out faster. That's what chronic sympathetic dominance does to your body. And what most people don't realize is that spinal dysfunction is one of the primary things keeping that alarm stuck on. But here's what's new, and this is where it gets really interesting. We can now measure this, not just symptoms, not just feelings. We can measure it in your brain waves. Your brain produces electrical activity that we can measure with an EEG, that is an electroencephalogram. And that activity falls into specific frequency bands, each representing a different state. So here's what you need to know. Some of these values will change and vary a little bit based on other publications and things, but beta waves typically go from 12, 13 up to 30, sometimes a little over that to 32. There are your stress and alternative waves. They emerge when you're focused, anxious, processing threats, or under pressure. When beta is chronically elevated, it's the neurological signature of the nervous system stuck in a fight or flight. High beta, high stress, high cortisol. Let's look at alpha waves. These are 8 to 12. And there are your rest and recovery waves. Calm, alert, healing. This is the state your brain needs to be in for your immune system to function, for your sleep to be restorative, for your digestion to work properly. Alpha is the parasympathetic state, and it's measured directly in the brain. Theta waves will go 4 to 8, some say 5 to 6. These are your deep relaxation, creativity, and memory consolidation. The research is clear on this. When sympathetic activity increases, alpha waves go up. When stress dominates, the sympathetic system is running the show. Beta takes over, alpha gets suppressed. Neuroscientists call this alpha blocking. Let's look at the chiropractic connection. There's some new data that's out. So here's where chiropractic enters the picture. And this is the part that should change how you think about what an adjustment actually does. Dr. Heidi Havek's research team has published multiple EEG studies measuring brainwave activity before and after chiropractic adjustments in peer-reviewed index journals with sham controls. And here's what they found. In a randomized crossover study published in Scientific Reports, that's a Nature journal, EEG was measured across delta, theta, alpha, and beta bands before and after spinal adjustments. The brain changed measurably in real time. In a 2024 study published in the Journal of Integrative Neuroscience, a single chiropractic session produced enhanced connectivity within the default mode network, the brain's resting state network, across alpha, beta, and theta frequency bands in patients with Alzheimer's disease after one visit. In a separate long-term observational study tracking approximately 100 volunteers over 3 years, EEG scans before and after adjustments showed a consistent pattern. Brainwave activity shifted toward alpha, the relaxed, healing parasympathetic state. Patients who started with an imbalanced high beta over-aroused patterns tended to normalize. Patients who were already balanced saw a little change, meaning the adjustment wasn't pushing past healthy baselines, it was correcting dysfunction. Let that sink in for a moment. A spinal adjustment, changing how a joint moves, is producing measurable shifts in brainwave frequency toward the parasympathetic state. This is not theory. This is EEG data. So let's look at the mechanism. Why does this happen? Here's the chain of events, and every link in the chain has research behind it. So the very first part we're going to look at is dysfunctional spinal joints send corrupted proprioceptive signals to the brain. That's what happens at the first step. The second step is the brain intercepts incomplete or distorted input as a threat. Sympathetic nervous system is activated, beta waves dominate, and alpha gets blocked. The third step or mechanism is the chiropractic adjustment restores normal joint movement. Signal quality improves. Brain is no longer interpreting the spine as a threat environment. The fourth step is the prefrontal cortex function improves. Sympathetic overdrive down regulates. Alpha waves increase. Parasympathetic activity rises, and it rises measurably. This is also why patients often tell us they sleep better after getting treatment. They feel less anxious, their digestion improves, their energy comes back. These aren't coincidences. They're what happens when the brain that was running on a high beta stress starts producing more alpha waves. All right, so now let's look at the effects. What sympathetic dominance does to your body. When your nervous system is stuck in beta, that's stuck in that sympathetic overdrive, here's what's happening to you. Cortisol is going to stay chronically elevated. That's going to start breaking down muscle, raising your blood sugar, and suppressing immune function. Alpha is going to be blocked. Sleep is going to be disrupted. Healing phases are going to be cut short. Digestion starts to shut down. Nutrient absorption drops. Gut motility slows. Immune surveillance is going to decrease, so inflammation becomes systemic. Your heart rate variability drops, and this is one of the strongest predictors of health outcomes. You're going to see hormonal axis is going to be destabilized. Adrenals, your thyroid, and sex hormones are all downstream of chronic stress. So none of these feel like back problems, but all of them can be downstream of a nervous system that spinal dysfunction has kept locked in sympathetic dominance. So let's look at some few more things. So what we're doing as chiropractors is we're not just moving bones. It's not a bone pressing against a nerve. We're literally changing the frequency your brain operates at. And we have the EEG data to prove it. Next video, we're going to talk about what happens when this goes on long enough that the brain stops just being stressed and actually rewires itself to amplify pain. It's called central sensitization, and it explains why chronic pain so often doesn't respond to standard treatment. Thank you for watching, and I'll see you there.